Health Watch is presented by UMass Memorial Healthcare. Here, caring for you.
Hi, I'm Caitlin Tivnan. Thank you for watching Health Watch presented by UMass Memorial Healthcare. It's back to school time, and you know what that means. Students are heading back into the classrooms, and student athletes are heading back onto the fields. We talked to one doctor who explained what parents and coaches are doing to help prevent concussions and also how to treat them.
Concussion is a mild traumatic injury to the brain. It's usually caused by a blow or jolt to the brain, and the shaking will cause the brain not to work as it normally works. So thousands of youth each year are diagnosed with concussion, given the number of youth that do participate in sports. You do not have to lose consciousness to have a concussion. In fact, only 10% of kids with a concussion actually lose consciousness.
How hard does someone have to be hit? How bad does the impact have to be?
Any impact to the head. I think any impact or jolt to the head should raise awareness that this child may have a concussion.
If you think someone has been hit either on the field or even in, I guess, playing, if this happens,
Absolutely.
What do you do?
So when in doubt, take them out. That's the first step that coaches and parents can do during a game or a practice. Is that child should be immediately removed from play, and that child should not be allowed to return to play that day. And they should be monitored carefully for symptoms of a concussion.
Are there symptoms that you would see in someone who does have one?
Yes, you would. You would actually see them telling you, oh, I have a headache, or I feel dizzy. They might be a little groggy. They may not completely remember what happened to them. They may be a little off balance. They may feel nauseous. So these are all signs and symptoms to look out for. And they can occur up to 30 minutes after, they can occur immediately, or even a few hours after. So that's why that child needs to be carefully monitored. Concussions, if left untreated and not managed properly, can have long-term consequences. And the brain of a child and adolescent is especially vulnerable to the effects of a concussion, because what we have to remember is a concussion is about chemical change and a metabolic change in the brain. It's like someone's shaking all those neurons, and they need to recuperate and function. And so I think we're seeing now that if we can manage this appropriately, when a child has his or her first concussion, we can prevent long-term consequences.
For more health news, stay tuned to Health Watch, or you can check on chartertv3.com and click on the Health Watch page. I'm Caitlin Tivnan. Stay healthy.